Well, head and neck cancer is a bit of a broad topic. It of course includes a lot of different things, but I guess if I were going to bring one thing to the forefront, it would be a mass or a lump in the neck. So the patient was shaving, and they said, "Oh, what's this lump that I feel in my neck?" Probably a neck mass, a neck lump that they notice is probably the number one presenting symptom. Well, that's a good question. It has a lot of different aspects to it. Uh, so a primary care physician is just going to do a basic physical exam. I mean, they're gonna look in the mouth, they're gonna examine the neck with palpation. Um, those would be the things in the ENT office. We might take a bit of a closer look, possibly using a flexible laryngoscope. But the idea of the risk stuff is tricky, really. Honestly, it is because certainly smoking and drinking are going to be big risk factors, but those are very much on the decline. So sure, you see your smoker and drinker patient, and that's going to be potentially a patient who's at high risk. But you brought up the HPV, and certainly the HPV is sort of the new form of head and neck cancer, and there really are no risk factors. I mean, it can be a bit of a, depending on your sort of comfort level with these kinds of conversations. I mean, there's no risk factor. I mean, most adults who have had, some sort of, average, let's just say, sexual life, most adults who didn't, who were not in monogamous relationships from junior high on, have been exposed to HPV. I mean, that's just the reality. It's a ubiquitous. Now, certainly, the greater the number of partners, but at the end of the day, it's a ubiquitous exposure, almost certainly, and it ends up being a function of the host immune response. So, I'm not sure that there's. I just wanted to mention. I mean, there's a lot of sensitivity about this kind of thing, and some of these conversations could be a little tricky. But the reality is that it's not like you're going to start probing people's history and finding out who's at risk and who's not for that. I mean, you sort of have to just assume that the risk is just ubiquitous. I mean, so there are certain things you can know about that. I mean, the exposure is ubiquitous, but the head and neck cancer aspect is quite a bit more common in men than women for whatever the reason. I'm not sure there's a known cause for that. In decades to come, we should see a precipitous decline in it because the HPV vaccinations that the younger generation gets are found to be enormously effective for cervical women's cervical cancers, and it appears that it should be just as effective for prevention of head and neck cancer. So that's why adolescents it's really recommended that they get it prior to the onset of sexual activity so that they can basically be protected. It should be a cancer that it shouldn't happen. I mean, anything's possible, and I've heard circumstances where it evades it, but the HPV vaccines are tremendously preventative. I mean, the treatment options end up being some combination of surgery, radiation, and chemotherapy, and yeah, it's a balance, right? It's a question of preserving function and eradicating the tumor. Um, every situation is different. The different tumor stages lend themselves to different options, right? An earlier stage situation may lend itself to surgery alone, And if you can have surgery alone, people avoid the side effects of radiation on the delicate tissues of the throat and whatnot. But sometimes there's too much to remove, and you end up sacrificing function, and that's where sometimes the radiation and the chemotherapy become better options. There's only so much tissue in the back of the throat. There's only so much tissue in the back of the tongue that you can remove without causing a functional deficit. So I'm not sure I can provide a definitive answer, but only to say that it's an important part of the decision-making process for deciding what's going to be the best treatment for each person's individual tumor. Well, the term that you'll always hear is multidisciplinary care, and that's what it is. In a perfect world, you have what are called tumor conferences, where you have and often they're done over Zoom, but in today's day and age. But you have a conference where you have surgeons and radiation oncologists and medical oncologists that are discussing patient care. So I think there's often a perception that treatment is standardized completely and almost cookie cutter, and like there's a right treatment and a wrong treatment, but it's really not quite that clear. There's a lot of judgment, and then there's some different opinions and different options, and so people may and each specialty brings their own experience to the conversation. So one person might say, oh yeah, I thought this was a good person to just have surgery. And the surgeon might say, yeah, well, but did you look at how close it is to such and such? I don't know that I can get that out safe. And then the non-surgeon may not have appreciated that aspect of it. So, that's just an example. So yeah, I mean, you have these different specialists in a room, a virtual room usually at this point, going through the discussion of the different cases, offering different opinions until a consensus is reached about how best to handle it. That's a perfect world. If you don't have the ability to engage in a tumor conference, then you can do the next best thing, which is just to have various physicians that you may interact with and talk with. So maybe you don't have a tumor conference, but you can certainly call your colleague, the radiation oncologist, and say, hey, I want you to see this guy. I don't think it's a great surgical candidate. Why don't you take a look, see what you think? And that kind of conversation is always going to be the best, the best way. The tumor conference is just nice because it puts everybody in the room at the same time, and there's an active discussion, but not everybody has access to that kind of situation. And as long as you make an effort to collaborate with your colleagues, that you can accomplish most of the same thing.